The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
Good morning, everyone. My name is Dr. Charlene Ortiz, and today we're going to continue our lecture with the states of consciousness. Now, our levels of awareness, we have covered those topics before. One of the last things that we decided to cover was how is it that we can alter on purpose our states of consciousness. So we did talk about meditation. We also talked about the topic of drugs, right? And the impact that they may have. So today we are going to continue with the topics of drugs and their impact when it comes to aspects of altering our states of consciousness and also aspects of addiction and dependency. So let's get started. Now, we have talked about previously, we talked about narcotics and sedatives. Today, we're going to continue with the aspects of hallucinogens. Now, generally, as the term suggests, the effect in states of consciousness when it comes to hallucinogens, it involves the altering, right? The altering of mental, right? Of mental and emotional functioning. Not only that, it's going to alter your perception and sensation, right? Of the stimuli around you. Now, if you recall from one of our previous lectures, you'll remember that all of us have the capacity of sensing, right, our external stimuli. For example, noise, smell, taste, and others. And later on, we have the ability of our brain to perceive said stimuli, right? Perceive said sensation. The issue, however, is that hallucinogens have the ability of distorting, right? They have the ability of distorting said sensation and perception. Now, when people engage in the intake of said substance, generally their desired effect is to change their sensory awareness. In some of those cases, that involves the alteration of your perception. Some people, right, engage in the intake of hallucinogens because they want to feel a euphoric state. Not only that, for some individuals, hallucinogens can lead to having insightful experiences, right? So what do we mean by that? Well, some people report that whenever they are under the effects of said drug, they report that they have become more insightful. For example, they become more creative, they become more artistic. Some people start engaging in art, right? For example, some people start painting, some people start writing songs, developing stories, right? Not only that, it may lead to a sense of euphoria, right? A sense of altered state. But notice that because your sensation is being altered, your perception is being altered, right? For example, the stimuli that you're coming across with, right, is going to be altered in your perception, right? So you're not seeing what the average person would see. You will not be hearing, you will not be feeling what the average person would feel or smell or taste. And because of that effect, some people look for that desired effect. They look for that altered state of consciousness. Now, I'll give you an example of a hallucination, right, outside of the drug realm. You're thinking, why is this important, right? Why are we learning about drugs in a one-on-one class? You as a future practitioner, right? You as a future practitioner need to be not only aware, but immensely knowledgeable about the effects that drugs can have in a client's emotions, thoughts, and behavior, because not only is it going to alter their sense of well-being and their goals, but it can also alter things in the office, right? So just last week, I have a client that unfortunately has immense and very strong hallucinations, very, very strong hallucinations. I've been seeing this person for a while. This person is a teenager. Unfortunately, mom and dad engage in a lot of drug intake and a lot of drug activity. And unfortunately, this child has reaped the consequences of their parents' alleged engagement of strong use of drugs. So this child currently is seeing me because he has strong hallucinations, right? And one of the things that brought him to session in the first place was that he alleged that voices and demons were commanding him to kill his sister and stab her in pain, right? So that's one of the reasons why I see this child. Luckily, homicidal ideation has decreased, in case you were wondering, so that has decreased. But we had receded a little bit, so he was doing a little better in the last couple months. And now, last Friday, he started hallucinating in session, right? So while he's talking to me, he started hallucinating. Generally, his hallucinations involve possession, so he will start acting out like he's possessed while talking to me. So you need to evaluate, and here we go again with the bias, right? So if you have a cultural bias, this might be impactful to you, right? So for example, if you have a client that's actively hallucinating in front of you, acting out that they have a demon that's possessing him, literally, sitting in front of you. Although this time was a little bit more, let's call it active. He stood up in his chair and he started acting like he was possessed, and his eyes rolling in the back of his head. So unfortunately, we had proceeded a little bit more into his active hallucinations, but luckily we don't have any homicidal hallucinations. So I bring this case that I had last Friday because me as a practitioner, right, I have to understand the impacts of drugs, the impacts that these can have towards a client. Unfortunately, even though he himself wasn't the person engaging in the drug intake, fortunately his parents allegedly were. If you're wondering, he's not under the custody of his parents anymore. His mother died of an overdose next to him. He was found in a hotel at 2 years old with his mother OD next to him. So it's a very unfortunate case, and I'm really glad that I get to work with this client. He's one of my most interesting clients, and I am lucky that I have the opportunity to work with him. But notice that a lot of my practice with him involves things that I even learned in a one-on-one class. So that's one of the reasons why we like to present the principal drugs that have been abused, because you will see that in real practice. So any questions about hallucinogens and when it comes to the desired effects or non-desired effects of hallucinogens? All right, good deal. Let's go back to our slides. Now, another drug that tends to be utilized frequently is cannabis, right? Now, generally, we engage in the intake of this drug through marijuana, right? Generally, when we think about marijuana, we are thinking more of the component of THC. THC is generally the component of marijuana that provides that altered state of consciousness. And when we are talking about marijuana, generally, the desired effect of that individuals are seeking is basically a state of mild euphoria, right? Some individuals do seek the intake of cannabis because they are interested, I should say, in the relaxation that this drug can provide to individuals. Not only that, it can also provide enhanced awareness with some persons. Now, there is a lot of research when it comes to the effects of marijuana and anxiety. marijuana and depression, marijuana and chronic pain, particularly that of lower back pain. So there is a lot of research that has gone under the study of cannabis. So that research has altered the popular thought of cannabis. Now, as with any drug, all drugs have desired effects, primary effects, and side effects. So part of that research is to understand what the principal effects can be, and what the side effects can be for the use of cannabis. So there is a lot of research trying to substantiate the potential benefits that it has, particularly with anxiety, depression, seizures. It's another one that there's a lot of research for cannabis and seizures, and also individuals who suffer from chronic pain, particularly that of lower back pain, and also people who are experiencing active symptoms of PTSD. So there is a lot of research when it comes to cannabis and the impacts that it could possibly have with some mental illnesses. So any questions about cannabis? Good deal. Good deal. So let's go back to our slides. All right. Alcohol. And now a lot of people find it a little bit difficult to see alcohol as one drug that is generally presented when we are talking about this class. Well, if you think about it, alcohol also provides an altered state of consciousness, just like nicotine, just like caffeine, right? So that is why it's classified as a drug, right? So any substance that can alter your current state would be considered a drug, right? So a lot of people do find it surprising to see alcohol, for example, as one of the drugs that we generally list, but we can also list nicotine, we can also list caffeine. If you're like me, I wouldn't have survived my college undergrad years without caffeine. That was just not going to happen. So notice that utilizing a drug, for example, caffeine, would also be considered a drug because it does alter the state of consciousness that that individual can have. Now, when we are considering alcohol, right, we're considering beverages that can have not rubbing alcohol, right? Although I have seen people drinking hand sanitizer, I have seen people drinking rubbing alcohol because of their addiction to alcohol, and they're looking for that desired effect. It is pretty unfortunate because now, it's going to burn their throat. So I have seen, unfortunately, people just trying to down a bottle of hand sanitizer. So it is pretty unfortunate. Now, what is the desired effect that this person is trying to engage in? Well, we're also looking for that mild euphoria, right? That individual is also looking for that state of relaxation. Because of that, some individuals can have a momentary or temporary reduction of their anxiety. But more importantly, one of the things that we're formally introduced to when it comes to alcohol is reduced inhibitions. And why does that happen? Well, as I mentioned earlier, alcohol, right, tends to basically what I like to call shut down your brain, right? Because if I were to put you under an MRI, if you remember our previous lectures, right, when we can see the activity that your brain has through images, you'll notice that the regular active brain, right, the regular brain is pretty active, right? And some people find it basically kind of ironic because when we are drinking alcohol, some people consider that they're being more active, right? But in reality, what is exactly occurring, right? What is exactly occurring? So what is happening with alcohol is that your brain, if I can pull this up on your screen, what happens is that your brain is going to start engaging, right? Your brain is going to start engaging and shutting down. While it's shutting down, what's going to happen is that you are going to be exposed to being more prone into not thinking rationally, right? So that's what tends to happen. See if I can find a good illustration of that image. A lot of people think, no, I'm actually being really hyped, really being really active, but in reality, what's happening is that your brain is shutting down. Why is it shutting down? Well, because your frontal lobe, for example, your frontal lobe is basically shutting down. And if you recall from our previous section, right, if you recall from our previous section, you'll remember that your frontal lobe is in charge of rational thinking, right? It's in charge of rational thinking. And because it's in charge of rational thinking, if you weren't prone to, when you're sober, oh, I'm not going to jump over this fence, right? Because it's not rational, right? If, for example, you were to drink some alcohol, right? If you were going to drink some alcohol, you'll notice that now more prone to jumping over this fence. It's like, hold my beer, right? And you're more prone to doing that type of thing because now your brain is not as active. Now you are more prone into engaging in more risky behavior because we're not thinking in the sense of being a little bit more rational, right? So let's see if I can find a good image for that. I did find a couple for cocaine, but that's not what we're looking for, right? Not looking for cocaine. Let's type in CT scan. That might be a little bit easier. Another interesting image though over here. I'll pull this image up for you guys. It's a really nice, cute comparison. So let's share this image. So if you notice, right, this individual would be considered a non-smoker or compared to a normal brain, right? And if you notice when the individual is engaging in alcoholism, you'll notice how the brain becomes less active. And that is because alcohol is a depressant. Let me remind you that alcohol is a depressant. It is not a stimulant, even though it does feel like that most instances. But alcohol is not a stimulant, it is a depressant, which means it shuts down your brain. Now, the impact of how involved you're going to be in drugs or some of those instances involve the user's age, right? The user's age tends to be a contributing factor, right, of the impact of said drugs. Your mood and motivation, right? Your mood and motivation. Right? It's going to depend upon the engagement of drugs. Another aspect is personality. People forget about that, right? Some individuals, because of their personality, would be more prone in engaging in substance intake, right? Now this one, for example, if you have a personality of being more of a thrill seeker, right? So this could lead you, for example, in looking into certain stimulants, I should say. Also, previous experiences with that specific drug, right? Here we're talking a little bit more about learning. We're talking a little bit more about, let's say, your previous reward and punishments that you have received because of the intake of that drug. So if previously you had, say, symptoms of depression, and then you drank alcohol, and momentarily you felt better, then it's likely because we received that reward, right? A negative reward, right? And when I mean negative, I mean that something was taken away, right? So symptoms of depression were taken away. You'll notice that you were more likely to engage in that substance use. Your weight physiology also involved in that sense that you may or may not engage or have desired effects. For example, women have less of the enzyme that breaks down alcohol. Therefore, women tend to become intoxicated faster and longer than males, right? Because women naturally have less of that enzyme that will break down alcohol. Now, it's really interesting because wherever you're engaging in the intake of this drug, so for example, that setting can have an impact, right, on whether you are taking the drug or the impact that that drug may have. So that's pretty interesting. It's not the same, and a lot of people will tell you that say, taking a shot of alcohol at home versus taking a shot of alcohol at the beach, at the lake, at the club. So the effects, as you can see, could turn differently and could be different because of that experience around you. The method of intake, right? The method of intake is another important aspect. It's another important aspect when it comes to the factors that influence the drug, right? For example, you could drink alcohol, right? Or you can have an alcohol enema. You can smoke alcohol, right? So there's different ways that alcohol can be part of that intake. Of course, some are stronger than others. Another interesting aspect of your intake of drugs is your expectation, right? Your expectation towards this drug, right? The expectation that you have when you are engaging in this drug. Now, remember, we have desired effects, right? So if I go back to our slide, you notice that you have certain expectations, right? You have certain expectations that you wish to have whenever engaging in that specific drug. Therefore, your expectation towards a substance, right? Your expectations towards that substance can also influence the effects of said drug. So any questions about factors that can influence drug expectations, drug intake, or their strength? Any questions? Good deal. Good deal. Now, when we are mentioning drugs, it's always important to mention tolerance. And what is tolerance? Tolerance is basically your ability to slowly but surely, right? So it's a progressive decrease in your response to a drug. And it's going to come from the more you're utilizing this drug, right? The more accustomed you become to this drug over time, the more intake you will need to use or engage in order to have the same desired effect. So for instance, if a person is used to eating a certain amount of mushrooms to become to have hallucinations or LSD or marijuana, right? They only did this much. Now, in order to have the same effect, they will have to engage in more, right? More and larger intake to have the same desired effect. Why is that? Because our body has the ability to engage in tolerance, right? We become tolerant of those specific chemicals. And we can actually take it back to our previous chapter, right? So if you remember in our sensations, right? Sensing cold or smell, right? We become habituated, right? We become tolerant. So for instance, if something smells really bad in this room, which is probably the person sitting next to you didn't take a shower all weekend, right? Say if something smells really bad, eventually you're going to become habituated to that smell to the point that you're not going to smell it the rest of the times, right? You would need more smell, new smell, in order to have that same effect. So it's pretty similar to the tolerance that we would experience with drugs. Any questions so far about tolerance? Right, if. Now, there are some impacts, there's some mechanisms that could happen and could lead to drug addiction. Let's talk about amphetamines and cocaine. By the way, caffeine has very similar effects to cocaine, so if you were wondering. Now, if you remember from our previous lectures, you'll remember that neurotransmitters, right, are the chemicals that enhance that communication, right, within our neurons that lead to changes in behavior. But what happens is that amphetamines and cocaine activate specific synapses, right? They activate specific connections, right? So if you remember, this is one neuron, right? It's one of the terminal buttons for a neuron, and this is my next neuron, right? This here's my next neuron, right? So neuron number one, neuron number two, okay? So remember that these neurons are going to communicate with the release of neurotransmitters. But what occurs is that amphetamines and cocaine and other forms of drugs, right, what they're going to do is activate and alter the specific activity in those synapses. So in this particular case, let's think about amphetamines. So what's going to happen is that amphetamines are going to increase, right? They're going to increase the dopamine and norepinephrine release in this synapse. Not only that, it's going to stop the natural process that would occur of reuptake. So if you recall from previous sections, whenever we are releasing a neurotransmitter, it's going to fit perfectly into the next receptor. And then whatever we didn't use will go back to the little vesicle, and it's going to be recycled for yet another time. But what does amphetamine and cocaine do? They stop this reuptake. Basically, if you will, become full with these neurotransmitters. Because not only is it going to stimulate more and more release, right? It's going to stop those neurotransmitters that shouldn't have been utilized and would have been recycled generally. You notice here, see if I can zoom in a little bit. You'll notice how the amphetamines are going to increase, right? They're going to increase that release. And then not only that, but cocaine will stop that reuptake from occurring, right? It's going to stop that recycling, if you will. Now, interestingly, as I noted, cocaine will slow down that reuptake that we will have for dopamine and norepinephrine. And this will occur in the serotonin synapses. Now, as you can see, because of this change of release, this change of both releasing and reuptaking, we will see impacts. We will see impacts at the psychological and behavioral level. This is because we have altered the circuits, right? The circuits that we would have had with dopamine, right? The naturally occurring circuits of dopamine. Because of that effect that we have of releasing this dopamine and releasing this norepinephrine and slowing down that reuptake, we have this desired effect of euphoria, of feeling well, and of course, that can lead to addiction because it feels good, right? So if something feels good, increases the chances that you will do it again. So any questions about that specific mechanism? Right. Let's go back to our slides. Now we talked about addiction. But let's talk about dependency, right? Dependency. The main difference between addiction and dependency is that addiction, we are seeking this desired effect, and with dependency, we need this desired effect. That's the main difference. A lot of people use them as synonyms, but they're not the same. But why is that? Well, because we have two specific characteristics for dependency. The first characteristic of dependency is that physical dependency and that psychological dependency. So notice that here we have a need, whereas when it comes to addiction in general, we have a want. This is very important because a lot of people do tend to confuse these terms, right? And as you can see, drug dependency would be much harder to treat, right? It would be much harder to treat because now your body has become dependent. Now your physical body, your brain has become dependent. And how do I know that? Because now you need to seek more of this drug to avoid a withdrawal. All right. And when I say drug, I mean anything. I mean, alcohol, caffeine, nicotine, hallucinogens, cocaine, sedatives, whatever form of stimulant or the depressant that you're utilizing. Right now, we need physically this particular drug because now your body has become accustomed to it at a physical level, right? We start having symptoms of withdrawal. So that leaves the person with a physical dependency to continue taking this drug in order to not experience the symptoms of withdrawal. Generally, this is immensely common with narcotics, sedatives, and alcohol, right? It's generally common with these three aspects. People who are highly dependent on and have a physiological and psychological dependency, of drug dependency, generally when they start drinking alcohol, they feel good when they're drinking alcohol, but then their body, remember, has become used to that substance, that altered state of consciousness. So for some people, when they stop drinking alcohol, they start having seizures, they start having hallucinations, right? Because now your body is trying to make up for that neurotransmission, that lack of brain activity. Now we're going from no activity to a whole lot of activity, right? So the person is having seizures, the person is having hallucinations. The same happens with caffeine. If you drink coffee every day, you drink a whole lot of it, right? If you're drinking coffee every day, you stop drinking coffee, you're going to start having nausea, stomach ache, issue with seeing, being able to see, blurred vision, right? Those are symptoms of withdrawal, which tells you that you had a dependency with caffeine. The same happens with cigarettes, right? So I don't want you to think this doesn't apply to me or it doesn't apply to my clients later in the future. Notice that any substance that alters your state of awareness is considered a drug. So caffeine would also be considered a drug. Nicotine would also be considered a drug. For example, some people start smoking, start gaining weight, become more aggressive and cranky, right? So there are symptoms of withdrawal. Now, I did mention, any questions about that? Yes, sir.
Do you know how long withdrawal usually lasts?
I'm sorry?
How long does withdrawal usually last?
It depends. So the question was, how long does withdrawal last? That depends on many things. It depends, first of all, if you recall from a previous slide, and let's go back for a second. Share the slide very quickly for those of you who are watching online. It's going to depend on many aspects. So for example, body weight, the physiology of the individual. It's going to depend on the potency of the drug that you're taking. It's going to depend on how much tolerance, right, have you built because of this particular drug. It's going to depend upon the type of treatment that you're receiving. So some people, it's interesting because some people will have alcohol poisoning. And the first thing that they tell them is you need to keep drinking, right? Because if you were to cut drinking right then and there, they're going to give you alcohol so we can start weaning you off, right? Depends on so many factors. Generally, for coffee, it can be anywhere between 2 days and a week, right? So if you were addicted to caffeine, but that's a general rule of thumb, right? So it highly depends on your body, your tolerance, how much dependency you have for the drug, how strong the drug was. And that takes me into the second characteristic of dependency, which is the psychological dependency. And why do I say that matters? Because in the sense of the psychological dependency, you will start having emotional and mental craving for this drug. How much are you craving this drug? Man, I could really use a cup of coffee right now, right? I want to do everything it takes to smoke a cigarette, right? So a person's behavior also changes. So how much of a risky behavior are you willing to engage in order to seek that drug, right? So that's another factor, the amount of risk that you would engage in to satisfy that craving, right? So that's why drug dependency has these two characteristics, right? Physical, psychological, and as I mentioned, the previous characteristics for physical impact and also psychological. How much are you craving this drug? So does that answer your question? Any more questions about that? Yes, sir.
Yeah, on the psychological dependence, could that also apply to medication?
Yes, yes. I don't want you to think that this only applies to like street or illegal drugs. This can also apply to general medication, right? This can apply to any sort of medication, right? So say you're taking some sort of, let's say, antidepressant, right? And you just cold turkey stop taking your antidepressant. It's going to alter your change of state. So now you're going to go, say, for example, some individuals, particularly younger individuals, I wouldn't say necessarily this age group here, talking more about the younger individuals, right? So they would stop taking medication and then they start becoming suicidal, right? So that's one characteristic of withdrawal, is becoming suicidal, right? So notice that the psychological and physiological dependence does apply to other drugs, right? So I don't want you to think it's just street drugs. It applies to anything that alters your state of consciousness. Does that answer your question? Any other questions?
Withdrawal illness kill you?
It can. It can. You can die because of withdrawal. You can. You can die because of withdrawal. For example, imagine a person who is addicted to alcohol or drugs or narcotics, right? That's, for example, we have methamphetamine clinics, because if this person were to stop taking methamphetamines cold turkey, this person can die, right? So that's why individuals go to these types of clinics to still be prescribed medication that's similar, that activates the same receptors, because if they were to cut cold turkey, they could die, quite literally. So that's why generally it's recommended that the person weans off whichever drug they are engaged in. Yes, it could kill you for sure. I've seen it live. I've seen people, unfortunately, with withdrawal symptoms. And the vast majority that I've come across with have been actively hallucinating. Very, very active, very, very active. Throwing up, a lot of vomiting, unfortunately, and I've had to see it live. It's part of one of the jobs that I have engaged in the past. And it's pretty unfortunate. You know, it's pretty unfortunate. It's one of those, and you look at this person, you're like, man, this is really sad. And then you're thinking they're in their 40s or 50s. It turns out the guy is 22. So it's a very, very unfortunate thing to see. So any more questions about that? All right, so let's go back to our slide. Let's talk about overdose. Let's talk about an overdose. Change our slides here. An overdose involves that of having a substance, and it was greater than what we needed for that desired effect, right? So it was greater than what you needed. Generally, what occurs in an overdose in the physiological sense is, for example, we're going to have an impact on the central nervous system, right? We have an impact towards the central nervous system, and what's going to happen is basically that your breathing, right, will come to a halt, right? Comes to a halt, which could lead to a state of coma. And because of that, we can start having aspects of brain damage and an increased risk of death in a very short amount of time, right? So whenever an individual is having a sense of risk for overdose, notice that it's I hate to say, a very snappy event. It's very short term because it can lead to brain damage. And we have talked in the past about brain plasticity and the ability of the brain to recover, which does exist, but the brain can only recover so much, right? So it could lead to brain damage, and therefore the person is at an increased risk of dying within a very short amount of time. Any questions about overdose? Yes, sir.
If someone overdoses, is there anything we can do for them to, help them hopefully survive?
Well, the first thing is to find a qualified professional, right? So one of the first things would be to find the most qualified professional, which generally is not someone in the room. Generally, it's someone that can provide a life-saving care, which would be a paramedic, and then keeping this person alive through medical care, which would be a paramedic. And then they release it to the next higher level of care, which would be a physician or a nurse later in the hospital. When in doubt, 911. That's the best piece of advice that anyone has ever given me. So when in doubt, just call 911. Someone knows better than you, right? And generally people who are overdosing, they are vomiting a lot. So for those of you who are taking CPR classes, you see putting people in the recovery position, which is on their side, right, and their arm, like that. So, but generally refer to the next level of care. So 911, paramedic first. Next level of care, which would be emergency care. So, any more questions about that? I have seen individuals overdose because of my line of work. One of the more interesting ones was a couple, right? A couple of people, unfortunately, that I've seen overdosing on flakka. For those of you who don't know what flakka is, it provides a euphoric state of consciousness. A lot of people like to call it the superhuman, right? Because it does take a lot to subdue the person. So you might have known that people, when they're responding to emergency call, they just can't stop the person. They will be tased, they will be tackled, and it's immensely difficult. So in that state, there is a lot of effects with that drug. Now, these are some of the more long-term effects if we are thinking about tissue damage, right? So directly speaking to that tissue damage, I should say, for example, snorting of cocaine can inevitably lead to the impact and deterioration of nasal membranes. Smoking crack is associated with a wide variety of respiratory problems. Now, this is more on the tissue sense, right? But if we think about a little bit more about the long-term effects, notice that drinking alcohol can lead to a higher risk of liver damage, ulcers, and hypertension. You can also be more prone to hypertension problems that in turn lead to an increased level of risk for stroke and heart disease. Not only that, it can start leading to neurological disorders. For example, long-term problems with memory, recollection, short-term memory, long-term memory, and what we call motor retardation. So basically becoming more slow physically and with reaction time. And it can also lead the individual to start developing and becoming more at risk for other forms of cancer. When it comes to risk with marijuana, we can have an increased risk for pulmonary disease. Now, that health risk associated with the effects and uses of marijuana can also include issues with attention and memory that can be present when the individual is not intoxicated, right? So generally, these type of effects you would see while the person is intoxicated, but there could be effects when the person is not intoxicated. Now, something that research has shown when it comes to the use of cannabis is that there could be a link, right? And remember, we talked about experiments before. So links involve correlations, and correlations do not equate cause, right? So I need you to remember that. However, there is a link, there's a correlation between the use of cannabis and persons who have severe psychotic disorders, which include very severe disorders and chronic disorders such as schizophrenia. So any questions about that? All right, good deal. And we talked about the direct effects. Let's talk a little bit more about the indirect effects of drugs. People who use stimulants, right? So we're talking about nicotine, caffeine, crack, right? Cocaine, right? So we have our stimulants. Generally, when we have a stimulant, we have less need to eat or sleep. We have less need to eat or sleep. If you remember from previous lectures, we have an active, right? We have an active nervous system. The parasympathetic and sympathetic nervous systems, right? And if you remember, sympathetic keeps me in the state of urgency, right? That keeps me in the sense of being active, right? Going from point A to point B, there's an emergency, I'm going to take off, right? Reduces your hunger, it reduces your drive, for instance. It reduces the chances of going to the bathroom, so it's very similar to that, right? I'm not saying it's that, I'm saying it's very similar. So because of that, people who are under a stimulant, nicotine, caffeine, cocaine, things of that nature, tend to not eat or sleep properly. Now, sedatives, right? When it comes to sedatives, for example, sleep aid, things of that nature, they come with an inherent risk of injuries, right? Because as I mentioned, we can come at a risk for slowing down, right? So, which is the reason why if you are drinking alcohol, it's not recommended that you start driving, right? Because you have less capability for that motor coordination. Now, people who abuse these sedatives, right? People who abuse these downers, if you will, are more prone to accidents. For instance, tripping down the stairs, right? Suffer very common mishaps. As you know, it can increase the risk of being part of a car accident. Now, drugs that have to be injected, right? So intravenous drugs, which is what this term refers to, drugs that are injected directly into the bloodstream, can increase the risk of having an infectious disease because many individuals, as you remember, right, we go back, right? We head back to that psychological dependence. What am I willing to do to satisfy this mental and emotional craving? So for those of you who are not addicted, maybe utilizing a needle that's unsterilized sounds bizarre. It's like, I wouldn't use that, right? I wouldn't use a needle that has that it's not clean or sterile. But notice that for a person that has this mental and emotional, psychological craving, this might not be a bad idea. So now they start engaging in more behaviors. The book doesn't necessarily mention this, but we can also look into behavioral indirect effects, right? We can start looking into behavioral effects. So for example, what am I willing to do, right, to satisfy this craving, right? So for example, am I going to start stealing? Am I going to start engaging in risky sexual behaviors for money, right? Am I going to start increasing the chances of me going to jail or prison because I have this need, this mental, physiological, and emotional need to satisfy this drug craving? Your book doesn't mention that, but I think it's really important because when you are dealing with the person who has become addicted to a substance or has become dependent on a substance, we tend to ignore what the indirect effects are to society, right? So if I become addicted to a substance that could increase or dependent, that increases the chances of risky behavior, i.e. using a needle that's not sterilized, anywhere to that to engage in a criminal activity. I'm not saying that people who are addicted will engage in this behavior. What I am saying is that it increases the chances for risky behavior, right? And you as a provider need to evaluate the risks that come with dependency. So for example, if I am dependent upon a drug and I'm going to do whatever it takes to satisfy this craving, what are the chances that I'm even going to show up to therapy in the first place? Right? How is he or she going to help me with my addiction when this feels good? Not only that, addiction and dependency, we can think about multiple ways that this addiction came to be. For example, learning how to cope, right? For example, a way that you learn how to cope with the class material here in class could be, I'm going to start smoking, I'm going to start drinking a lot of caffeine, some Red Bull, right? So I can cope with the demand of the class, right? So notice that we start learning that drugs and substances can assist me into coping with stress, anxiety, depression, trauma, history of sexual abuse, right? So notice that your book doesn't mention that, and I understand this is a one-on-one class, but I do want you to reflect upon that. The impacts that we see here in a one-on-one class, and how is it that it's related to higher order problems when it comes to the therapeutic setting. So any questions about that? Good deal. Actually, fairly recently, very unfortunately, I was taking the trash out at my place of employment. And when I was dumping the trash, I saw something like red. I'm like, what was that? Turns out that one of our clients was drinking before they walked in the session and after they walked in the session. So they would just go drink in the bathroom, take a couple shots, go to the session, finish the session, and take a couple shots. So of course the client was confronted about that. And we knew immediately who the client was. There was no question about who that person is. But what that tells me is that the person has learned to deal with coping with severe issues like i.e. confronting problems in session with drinking. So that was addressed with the individual. So I told my boss, like, look what I found. And it's unfortunate that some people deal with drugs and alcohol as a method of coping, but it is your job as a practitioner to assist these individuals with learning new coping mechanisms in order to replace the one that they have learned, i.e. cocaine, caffeine, whatever the substance may be. Now, when it comes to psychology or in a social historical context, right, and thinking about the altered states of consciousness and drugs, notice that in the 60s, right, and as you know, psychology is a new science, by the way. Psychology hasn't been around for long. Tops, maybe on a good day, we can estimate it's 200 years when compared to other branches. So for example, math, right? Engineering, right? That has been around for thousands of years, right? Hundreds, if not thousands of years. You have physics, so you have the older sciences. But psychology as a science, as implemented the scientific method, it's pretty new. It's a pretty new science. So when we're thinking about the 60s, it doesn't sound like that was that long ago, right? Now, during that time, we started showing interest in alternate states of consciousness through the use of drugs, through the use of meditation and hypnosis. How did psychologists decide it was an appropriate method, right? Well, psychologists started to study the variations of consciousness, right? When it came to the uses of drugs, medication, and hypnosis, I should say. Look at that, that line's perfect, that's super straight. Now, another aspect of psychology is that we come to understand that just your experience in general, outside of that of variations in consciousness, is highly subjective already. Your states of consciousness are highly subjective. The way that you evaluate your world is subjective. So for instance, some individuals here may say, oh, I love Dr. Sharp's class. I love it. I think it's super cool. I like the presentation. I like the slides. I like the examples that she gives out. And some of you may say, I absolutely hate this book. I think this class is utter, right? And simply they don't like the presentation. So notice that your experience is going to be subjective. Imagine if now we have an altered state of consciousness, right? And remember that the changes in consciousness that you're going to have, that are produced by said substances can depend significantly on your personal expectations. So if you're engaging in drug intake and you're thinking, this is what I'm going to get out of this drug, that is going to sway you and lead you into having that experience with said drug. Something to recall from the themes that we have discussed in this and our previous lecture is that culture is going to mold some areas of your behavior, right? For instance, right? Some individuals can engage in the use of hallucinogens, right? And a lot of the hallucinations that we have, especially when it comes to schizophrenia, and I think I brought this up before, is your culture is going to mold your behavior, right? So for example, even when it comes to seeking the drug in the first place, right? I need you to imagine how teenagers here in America seek alcohol. And I need you to compare it to, say, for example, someone in Latin America who is seeking alcohol. Think about a European, Western European individual, say for let's say a German person, and how they go for alcohol. Even you seeking, the way that you seek that substance is going to be molded, it's going to be impacted by your culture, right? Not only that, but say, for example, the expectations that we have as a culture, right? So for example, in a college environment, right, we're thinking about intoxication as a good time, right? We're thinking about going to dance all night, I want to have a good time, I want to meet someone, right? So we're thinking about that cultural college culture of how we're going to expect those effects of alcohol. But imagine if instead of a college culture, now we're thinking more about, let's say, a veteran culture, right? So dealing with a lot of trauma, dealing with a lot of aspects that could be detrimental in coping. So notice that reaction, right, to the use of the substance was different because of the culture that this person found themselves in. As you recall, culture also has an impact on sleep habits, and we did mention that regarding individuals who, for example, have reviewed naps. How do we view sleeping early, waking up late? Interestingly, something that I need to mention is that culture can have an impact whether or not people remember their dreams. But more importantly, I'd argue, is how culture has an impact in how we interpret and feel about our dreams. So for instance, you may have a dream about your deceased parents, deceased grandparents, and some people here would view that as something sad, something tragic, whereas in a more religious culture, we may see that as maybe God is trying to send you a message, maybe your ancestors are trying to talk to you. So notice that the interpretation of that dream was different based on the culture, the eyes through which you were seeing that interpretation. Now, if you don't take anything from the 101 class, right, if you don't take anything from the scores in general, you need to understand that everything psychological, everything behavioral is multifactorial, right? Which is why we do a lot of statistics in this field. Because everything that we analyze does not tend to be black and white. There tends to be many, independent, dependent, moderating, covariant variables that can impact causation, right? So remember, if you don't take anything from this class, should be that we run a lot of statistics and many statistical procedures because most of the time behavior is immensely complex. You don't remember anything else, that should be it. Now, in regards to, say, for instance, the effects of an altered state because of jet lag, sleep deprivation, or psychoactive drugs, remember that the effects of said drugs, we try to find very simplistic explanations to things. And that's just one of our faults as human beings, right? So for instance, we try, we hear this horrible case, right? This guy killed these people and it was horrible. And we tend to oversimplify that explanation. Oh, he did this because of X. In reality, it wasn't just X. It was multiple factors that led to that behavior. But we tend to oversimplify that explanation. And it comes to you as a researcher, as a future psychologist, to conduct the research and these statistical procedures to show variables that could affect said behavior. Any questions about that? Now, because psychology has different schools of thought, right? we did have conflicting theories of dreams, right? And the impacts about hypotheses. So if you remember, we talked about why is it that we dream, right? Well, we really don't know why we dream. We do have a couple theories and hypotheses that try to explain the reasons why we dream. So for example, with Freud, we talked about how your undisclosed, unconscious desires, generally those of sexual nature, tend to manifest themselves towards dreams. We also talked about how the antithesis model would show me that the only reason why you dream is because your brain is active. So that's more of a neuropsychological model, right? We have other models that say, well, we dream because we like to see, we like to rehearse, we like to practice, we like to train for the events that could happen, right? So notice that these sound like conflicting explanations to dreams. Now, because of that, there is still much mystery, right? There's still much controversy and mysteries that we just simply don't understand, right? We simply don't understand them for now, but that doesn't mean they can't ever be understood, right? Maybe you're the next scientist that can provide that explanation, right? Maybe your grandchildren or great-grandchildren can provide better and sound explanations. Currently, we're going towards the right direction, right? It's an unknown, but because of research and science, we can start providing some answers, hopefully in the near future. So any questions about that? Now, these are generally common questions that we come across, right? Generally, these are questions that we come across when it comes to sleep. Now, remember, first one would be, how much sleep do people need? If you recall from our previous lectures, it varies immensely, right? So newborns can go anywhere between 16 and over hours. Adults tend to be 7 hours. Elderly individuals can go anywhere between 5 and 6. But if you look at it in an average sense, generally adults is 7 hours of sleep. Now, because people differ so much in how they sleep, this tells us that theoretically, right, we can hypothesize, I should say, that sleep needs vary. I love sleeping like 10 hours every day, and I'm not a teenager, right? Clearly, I'm not a teenager. All right, so I love sleeping for long periods of time, which can tell you and hypothesize, well, there is a different need, right? Because teenagers and people around your age tend to need a little bit more sleep. So tell that to your parents. Dr. Shar said that I need more sleep because my brain is growing, right? I'm a smart boy, I'm a smart girl, right? So just tell them that. You just need to take a nap. It can't be your chores at home. So no, she said I need to sleep. Now, can naps help me? Can naps help me? Well, it varies from person to person, right? The general answer is yes. The impacts of napping can vary from person to person. It depends, first of all, the time of day that you take the nap and the amount of sleep that you have had recently, right? So a lot of individuals would say, and I'll use myself as an example, I love sleeping for an extended amount of time, but I don't nap, right? I tend not to nap, right? I did take a nap yesterday, which was refreshing. Then I woke up not knowing what year it was, right? But notice that depends on the amount of sleep that I've had previously and the time of day that you took those naps. For example, is it too close to the hour when you generally go to sleep, right? So that can have an impact on how many benefits can you get from napping? Now let's talk about the significance of snoring. Generally, snoring is not good. I'll let you know right now. Other than you want to punch the person right next to you that is snoring. Other than that, and their safety, right? Generally, snoring is associated with certain illnesses. So for example, issues with your circulation and your heart and sleep apnea, right? So other than the comical aspect of you just want to, nudge the person right next to you that is snoring, right? For those of you who dorm together, right? You just want to slap someone because they're not letting you sleep. Other than that, it could be risky. It's actually a risky thing. It has more medical significance than what most of us like to admit, right? So, or most of us tend to understand. So it is significant. It is significant. Now, another typical question is, what can I do? What can I do to avoid sleep problems? You'll be surprised how many people you will see in practice that have this same question. I can't sleep, help me sleep, right? I can't fall asleep. I can't stay and remain asleep during the night. I wake up too early, right? So those are generally the three main problems that you'll see with your own clients and patients. They can't fall asleep, they wake up too much, or they wake up too early. Generally, it's those three. Now, the first thing is to develop a sensible daytime habit, right? Develop a sensible time habit that you will see that it's not going to interfere with your sleep. If you're starting to study at 8 p.m., right, and you know you're going to study for a couple hours, your brain is still going to be active. That's not going to allow you to sleep once you want to lay down. You want to reduce the consumption of stimulants, caffeine, nicotine, hopefully not cocaine, but if you do, don't do it, kids. Don't do it. Don't do it. And you also want to establish a reasonable, regular bedtime. Don't do as I do. Do as I say. I go to bed like at midnight or 1 a.m. every day. I love it. Love to go to bed late. So don't do as I do, as I say. Right? I love going to bed super late. Next thing is try to avoid the use of cell phones. Try to avoid that immediate reward sense. Not only do we have studies about the lights that cell phones have, but also the entertainment factor that comes from cell phones, the stress factor that comes from cell phones. So even if you're putting your phone in night mode or change the lights on your phone, notice that you're still getting that, if you will, stimulant from your phone, right? So even if you change the light, it's still seen as a form that can keep you distracted. Now, what about insomnia, right? Insomnia, whenever you start going into your more advanced courses and graduate courses, you will see more, especially when you go to your master's and doctoral level, you start seeing means as to what does insomnia mean. Insomnia is generally, I hate to say it, but insomnia is not generally the disorder that you're treating. Generally, you're treating something else that has led to insomnia. So I'll say that. Generally, insomnia is a manifestation of something much deeper and much severe than the sleep, right? So maybe you're not sleeping because you have depression, right? Maybe you're not sleeping because you have anxiety. Maybe you're not sleeping because you're not coping well with trauma. Maybe you're not sleeping because XYZ factors, right? So generally, I like to think about insomnia as a manifestation of symptoms, although it could be its own little monster, right? It could be its own little illness, right? Generally, when I hear a client, I can't sleep, generally I start thinking about, there's probably something else that we're not talking about today. Generally because the client's not ready to talk about it, right? But it's up to you as a therapist to guide the client into going into deeper layers that what generally brought them there in the first place. So when we're thinking about insomnia, think about what things can lead me, right, into a pleasant daydream, right? What things are you doing during the day that are pleasant, that can lead to this pleasant state of thought. Now, generally, and as you know, I'm not a physician, and this is not a medical suggestion by any means. However, with research, we do know that melatonin can address issues in regards to sleeping pills, right? So generally, melatonin is seen as another alternative. Another question that we typically tend to find is, does everyone dream? And the answer is yes, everybody does have dreams. It's just that some individuals cannot remember their dreams, but everybody does dream. Everybody does have dreams. Now, when people are awakened during REM sleep, and if you recall, REM, right? REM is generally the stage in which you are dreaming. If I wake you up during that time, most people will tell you that they were having a dream. There are many instances as to why some people don't remember their dreams. First of all, it's because it's pretty normal. It is more common to not remember your dreams than it is to remember them, right? So in a general sense, yes, we don't remember because it is normal. That is the norm, is to not remember your dreams. Now, generally, most dreams tend to be forgotten forever because we haven't been woken up during a dream, right? So if you're not woken up during that stage, generally people will tend to forget them. Now, interestingly, your book doesn't mention that. Most people who hear dreams in color. Anybody? Dreams in color, like full color. Okay, it's about a third of the class. Okay, who here dreams in third person? Like it's a movie. Like you see yourself kind of like a video game. You know what I'm saying? Like you see yourself like you're playing an RPG or something like that. Those are the more rare types of dreams, right? They tend to be pretty rare. That shows a lot of self-awareness with the individual, right? So if you dream like that, you have a lot of self-awareness. They are the more rare types of dreams, right? I do dream in color. Fortunately, my dreams are very vivid, right? So the more vivid they are, there's a lot of explanations why dreams can be vivid, like you're feeling it, you're seeing it, it feels very real, right? So there's characteristics about that. Sure. The book doesn't mention that, but it is less common to dream like that. We need to interpret dreams. Well, yes. But the issue with that, some people would say it's really difficult. The thing about that, at least in practice, what we like to do, if you're not a Freudian therapist, you like to have the interpretation, you want to have the person have their own interpretation of their dream, because my interpretation could be skewed or biased and may or may not apply to you. So generally, we guide that person to having their own interpretation unless it's more of a Freudian state of mind or school of thought. Now, many individuals have believed for a very long time that dreams are symbolic, that there are symbols to be interpreted, right? So not only these symbols are needed in order for us to interpret our dreams. So that is a very commonly held belief, is that symbols in a dream tend to be what leads to interpretation. So as I mentioned, I think in one of the previous classes, for example, women dreaming about riding a horse, well, the interpretation is horses are phallic. There's a lot of representation of or symbolism when it comes to a horse and a penis. So people who are Freudian would say, well, this woman just wants to have sex. That's why she's dreaming about horses, right? So that's one of the symbols. So I would just have the person interpret it themselves and be like, what do you think it means that you're riding this horse, right? So that's one of the Freudian interpretations for that. Now, let's talk a little bit more about alcoholism. Alcoholism is a very, yes, ma'am.
Going back to something like where does sleep paralysis stem from?
I'm sorry?
Where does sleep paralysis come in? Because
So the question is, when does sleep paralysis occur? Now, if you recall from our previous lectures, we talked about the stages of sleep, right? We talked about our body, right, naturally, right, releasing hormones to keep us stiff because otherwise we will act out our dreams, right? So for example, if you're dreaming that you're running in a meadow, you're going to start acting like you're running in a meadow, you can get yourself hurt. So your body naturally paralyzes you so that you don't act out your dreams. The problem is that sleep paralysis comes in when you are starting to wake up, but the effect of paralysis has not worn off, right? So instead of waking up and this process being worn off, the person starts hallucinating because it's a really vivid dream to which they can't get out of because they are naturally paralyzed. So in those stages that you're supposed to be paralyzed so that you're not acting out your dreams, so your body does that to protect you, that's when sleep paralysis comes in. The individual, the process of being stiff and being still has not worn off, but yet they're awake. So now we start hallucinating, right? It's really, I don't suffer from it, but I have unfortunately seen people that do, and apparently it's immensely terrifying. It's very, very terrifying. Yes, ma'am.
So would the sleep paralysis really just be you're dreaming, but you're like, is it like cognitive dreaming, or are you awake or are you not awake?
So it's a half state. It's basically you're still awake and you're still dreaming. It's basically like a,
So you're like, your body woke up, but your brain's still dreaming kind of thing?
Basically, they're both asleep if you truly think about it, because you're still stiff from that effect and you're wanting to move like with ordinary wakefulness, but you can't. And then your dream, you start thinking, I am at home, but here's this horrible demon on top of me crushing my chest and I can't get out of this, right? So it's a half and half, really. It's a half and half state.
Last question about that. I've seen people suffer from it when during the daytime, like they would eat dairy or something, and then they would suffer from like sleep paralysis at night. Have there been any studies that have linked those things?
Unfortunately, I don't know much about that, so I would be guessing if I gave you an answer for that, but it's certainly something to look into for sure. Now, unfortunately, I don't have the answer to it, but it sounds like something to Google, give it at least a little bit. And actually, and this is a good example of being a good scientist and researcher, is saying when you don't know something, okay? This is a teachable moment, kids. You don't know something, the right answer is, I don't know, okay? Trying to look into something else doesn't really answer the person, and you're giving them misinformation. As you know, alcoholism is a very significant problem. It's a very serious problem. If it is a disease, right? If in this case we're looking at alcoholism as a disease, the impact of alcoholism is that it causes its own sickness, right? So for example, drinking alcohol, we can see it as, well, it's causing its own illness. But if we're not viewing it as a disease, then what else can it be? Now, some people may label alcoholism, for example, as a sign of weakness, as a sign of crime, sin, mental disorder, physical illness. So notice that depending on the scope in which you are trying to evaluate alcoholism, whether as a disease or not a disease, we start labeling this condition differently. Some people say you're not an alcoholic, you're just a drunk, or you're just irresponsible, or you're just a crook, right? So depending on how we label this disorder, many people start looking at this differently, therefore it will be treated differently. It is relevant. Labels are important because it can have economic, social, political, and other forms of interpretation, right? So if I'm only a drunk, then what's the point of me seeking help, right? So notice that labels do actually have an impact even in our field. Now, it's very difficult, right? It's very difficult to fit alcoholism in a definition of a disease. Why is that? Because generally we define disease in general as the impairment of normal functioning, right? That is going to alter your basic vital function. Now, we do understand that alcohol does in fact impact people's normal functioning. But the critics argue, well, defining alcoholism as a disease now creates a new market, right? Now creates a new market for the health industry. I do consider alcoholism to be a disease because once I label it correctly, I can start treating it, right? So that brings us to the end of our lecture, and thank you very much for your attention.